Hello, dear NA community. What is the significance of Samprapti? There are 5 types are being mentioned. What is some significance of each of these subtypes? How that will be helpful in making the accurate diagnosis, or what we can say the Vyadhi Vinishchaya in an individual who is suffering from it. So these are the discussions will be done in this particular video. Dear NA community, put the thumbs up and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. Don't forget, press the bell icon so that YouTube algorithms will fetch you the right information for the right purpose at the right time. The term Prapti refers to the pathological events that are taking place inside the human body. Its significance lies, as per the Madhukosha commentary, asatyam cha sampraptau पूर्वरूपादि प्रतीतस्यापि व्याधेः चिकित्सोपयोगिनो अंशांश कल्पना बलकालादेरप्रते अप्रतीतेः च चिकित्सा विशेषो न स्यात्. In the sense, so the Samprapti, knowledge of Samprapti will be helpful in determining the Amshamsha Kalpana. Amshamsha Vikalpa in the sense that is the permutations and combinations of the increase or decrease of certain gunas of the dosha as such. Bala in the sense that is the strength of the particular dosha or the nidana, etc. etc. And regarding the kala refers to the timing of the occurrence of the symptoms. So that will be helpful in determining the actual the disease as such that will be manifested in an individual. Pradhanyata of the dosha, which particular dosha is dominated at a particular time period. That is also helpful in determining the what do you say that the disease as such. Thereby, all these are the points that will be learned in learning about the different types of the Samprapti as such. Lastly, there is being mentioned that is the concept of Vidhi Samprapti as such. That is the classifying the diseases depending upon the different criteria. That is Mrudu and Daruna. So this particular classification is made based on the Rogi Bala and Roga Bala. Whereas another 2 types of the diseases are being named based on Svathat Vaishamya Nimitta and Agantuja Nimitta. So that is mainly indicative of Nija and Agantuja Vikara, wherein the clinical manifestation, so that will be later after the dosha prakopa in case of the Nija Vikara, whereas in case of the Agantuja Vikara, we are going to observe the first clinical manifestations itself. And regarding the Adhyatmika, Adhibhautika and Adhitaivika Vikara, so that will be helpful in actually planning the line of treatment as such. So in that way, each of these further subtypes of the Samprapti, that will be helpful in the Vyadhi Vinishchaya accurately. So now we are going to learn about these with giving the few examples. For example, when you think about the Amshamsha Vikalpa, so here this is actually helpful in determining the Vyadhi Vinishchaya based on the Vikalpa Samprapti. So what is this Amshamsha in the sense what? So that is nothing but the different gunas. We know that the Vata dosha is having Ruksha, Shita, Lakhu, Khara, Sukshma, Chala, etc. Pitta dosha is having Snigdha, Tikshna, Ushna, Sara, Drava, etc. Lakhu, Visra, etc. Kapha dosha is having Snigdha, Shita, Guru, Manda, Shlakshna, Mritsna, Stira. So these are the different gunas of the different dosha. So these individual qualities are being considered to be Amsha as such. Whenever if you think about the Amshamsha Vikalpa, we are going to observe which particular Amsha of the dosha is going to get increased. For example, here an individual is consuming poha or beaten rice. So it is being prepared in this way. which is being shown in that particular image. In the sense, so the person is going to consume these particular substances, Ruksha substance, initially the system that is going to get afflicted because of this will be alimentary canal. So that means the Ruksha Guna, which is being abundant in this particular dish as such, so that will be immediately responsible for the increase of the Ruksha Guna in the alimentary canal or Mahasrotas itself. Suppose if the person is having the abnormal entry of this particular poha into the respiratory passage, maybe to the larynx or maybe to the nasopharynx, then we are going to observe the lakshanas related to respiratory system. In this way, the Ruksha Guna, so that may be increased in the body as such if the person is going to consume this particular substance as such. So that is naturally we are going to say there may be a possibility of a Vata dosha prakopa there. Second image, so that is the lady is doing the activity in the cold environment. So that means whenever if you think about it, all the body parts, they are being covered by the cloth. But the body part which is not being covered by the cloth is mouth. So that means the Shita Guna exposure will be observed to the twak of the face itself. In that way, so the Amshamsha Vikalpa in this particular occasion, there will be Shita Guna increase, that too observed in the twak of the face region. In that way, Amshamsha Vikalpa will be helpful in making the clinical diagnosis. In the sense, how this will be helpful in the treatment, planning the treatment as such. Suppose if the person is going to consume Ruksha Guna substances, naturally we have to avoid Ruksha Guna substances. Instead, we have to administer Snigdha Guna substance. That will be considered to be the line of treatment in this particular occasion. For a second instance, the person is exposed to, the lady is exposed to Shita Guna. So that means she has to apply Ushna Guna substances as such to the face as such. So in this way, so this will be considered to be what we say that the Amshamsha Vikalpa understanding. Or otherwise, in case of the Shita Guna, which may be responsible for the increase of the Ruksha Guna in the face, so that means application of Snigdha Guna has to be done in that particular situation. This how, so this Amshamsha Vikalpa or Vikalpa Samprapti will be helpful in making the clinical diagnosis as such. So that means where there will be increase of either one guna or two guna or more gunas, we are going to observe them. Regarding the Bala of the dosha, etc. So this will be done with the help of the Bala Samprapti as such. Suppose if the reason the gobi Manchurian is being prepared, so there are three different ladies are there. In that, if the first lady, so that is the small girl, so 6 or 10 years old, if that girl is consuming the whole amount of this particular gobi Manchurian, there may be a possibility of a pitta dosha vitiation may occur to the maximum extent, because the body weight is comparatively less, surface area of the lady is comparatively less, but the amount of the food substance is more. So that means there will be a possibility of pitta dosha vitiation. Similarly, if the 15-year-old is going to consume same amount of the gobi Manchurian, there may be a possibility of pitta prakopa, but the amount of the pitta dosha vitiation may be comparatively less when compared to 10-year-old girl consuming the same amount of the gobi Manchurian itself. This is how we are going to observe the dosha dominance, the virulence of the dosha dominance we can able to predict. How this is helpful in making the clinical diagnosis or the treatment as such. Suppose if you are giving the 10-year-old girl, the treatment is there, somewhat less potent medicine we need to add. 15-year-old girl, we need to add some more potent medication that has to be added to pacify the effect of the dosha as such. This is how the Bala Samprapti may be helpful in making the clinical diagnosis. Regarding the Kala Samprapti, suppose the lady is presented with headache. If this particular headache is specifically seen in around 12 in the noon time, so that is indicative of there may be a possibility of Pitta Dosha Prakopa there. Or if the lady is having this particular headache specifically observed at 5 o'clock in the evening as such, we may suspect there may be a possibility of Vata Dosha Prakopa. Or if the lady is presented with the headache at around 8 or 9 o'clock, then we may suspect there may be a possibility of Kapha Dosha Prakopa like that. So the significance of this in making the as such, that is, we are going to give the appropriate treatment itself. Suppose if the lady is presented with pain at around 12 o'clock in the mid-noon, then we have to give the Pitta Dosha Rajkitsa itself, so that we can get the recovery from the headache maybe a little bit faster as such. This is how the Kala Samprapti may be helpful in making the improving the clinical condition of the patient as such. Regarding the pradhanyata of the dosha, so here the example is the lady is presented with the pain in the right knee joint. When you think about the left knee joint, right knee joint is comparatively swollen. So that means there may be a possibility of the kapha dosha vitiation may be there. So of course there may be a possibility of vatanubandha because she may be having the little bit amount of the pain as such. But pitta dosha vitiation is little bit difficult to predict because there is no specific redness is being noted. Hence, we are going to say that there may be a possibility of kapha pradhana vikara rather than pitta dominance is there or the absence of pitta, but there may be an association of vata dosha is there. Its significance is if you are observing kapha dosha dominance, then we have to give the kapha chikitsa. If the lady is having vata dosha dominance in the disease manifestation, then we have to give vata prakopaka chikitsa as such, so that vata shamana may be there and the patient is going to get the benefit at the earliest possible amount of time. This is the significance of pradhanya samprapti. Then regarding the subcategory based on the different parameters. So here this is actually helpful in assessment of vidhi samprapti as such. So here the 4 such examples are being given. Of course, still much more examples can be added here. Mrudu and Daruna. So here the term Mrudu and Daruna refers to the Rogi Bala and Roga Bala. If the Rogi Bala is more than the Roga Bala, so that means it could be considered to be Mrudu Vikara. Whereas if the Roga Bala is more than the Rogi Bala, then it is specifically indicative of a Daruna Vikara. The significance of this is if the person is suffering from Mrudu Vikara, we have to give with Mrudu Virya Dravya or Mrudu Virya Dravya Yukta Chikitsa as such, or if the lady is, or if the person is having Daruna Vikara, then we have to give the more potent medications as such, or Tishna Virya Dravya has to be given. Second such category, that is Saumya and Agneya. The term Saumya refers to Vata and Kapha dominant Vikara as such, whereas Agneya Vikara refers to Pitta dominant diseases. If you are observing the person is suffering from Saumya Vikara, then we have to adopt either Vata or Kaphahara Chikitsa. And if the person is having Agneya dominant Vikara, then we have to adopt Pitta dominant or Pitta Shamaka Chikitsa has to be planned. Third set as such, that is Amasha Samutha and Pakvasha Samutha. The term Amasha Samutha, wherein there will be Pittaja and Kaphaja Vikaras that may be having the Udbhavasthana as such. If you are observing the Udbhavasthana as Pitta or Kapha, then we have to follow the line of treatment of Amasha Samutha Vikara. And if you are observing the Vata dominant disease as such, then we have to say that there may be a Pakvachaya Samutha Vikara. That's how we are going to give the Chikitsa for Pakvachaya Samutha Vikara as such. The fourth category, that is Shastra Sadhya and Snehadi Kriya Sadhya. Shastra Sadhya refers to the diseases which are cured only by surgery as such, or surgical instruments. Whereas Snehadi Kriya Sadhya refers to the diseases which are cured by Sneha, etc., Panchakarma line of treatment. So the significance is, if you are identifying that the person is suffering from Shastra Sadhya Vikara, then the probably Panchakarma, etc., may not help as such. Whereas if the person is suffering from Snehadi Kriya Sadhya Vikara, then usually Shastra Sadhya or surgery is not advised there. So this is how, so the Samprapti that may be helpful in making the accurate Vyadhi Vinishtaya, so that we can able to make the accurate diagnosis, so that we can able to predict the accurate prognosis itself, so that the patients are going to get the better faith on us, and they will be following whatever we are saying, even including the treatment also, and they are going to follow the proper patya also. To sum up, Samprapti refers to the series of pathological events that are happening inside the body, in the sense from where these particular pathogens are entering into the body, from there where it will be moving, how that will be moving to the Rasadhatu or Raktadhatu or Mamsadhatu, etc., Mutra, Purisha, etc., and how this particular dosha are going to get eliminated. All these are considered in analyzing the Samprapti as such. So, whenever if you are thinking about it, we need to know about the site of the entry of the pathogen. Then we need to know about the movement of this particular pathogen from one part to the another. And third, we need to know about the from where this elimination is happening. Several other parameters are there, that is Vikalpa Samprapti, Pradhanya Samprapti, Bala Samprapti, Kala Samprapti, and Vidhi Samprapti. So, which may be helpful in making the accurate clinical diagnosis, so that we can able to administer accurate line of treatment for the specified time period, so that the patient is going to get the maximum amount of relief as such. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video you would like to hear the coming days in this particular channel? Mention in the comment box below. And spread this particular video to maximum number of true Nidana learners, so that we can make a huge movement out of this particular small message. Dear ANA community, put a thumbs up and press the bell icon, so that the YouTube algorithms will be fetching you the right information in the form of right video for the right purpose at the right time. Thank you.